In this session of Advanced Pharmacology, we're going to discuss some of the California Board of Registered Nursing requirements. This session will discuss some of the legal requirements that the board wants you to know. All nursing students applying for furnishing privileges in California must complete this module. It'll discuss some key points and some enabling objectives. So let's begin by looking at this session. First, let's look at some required key points. This course must include a mechanism for ongoing communication between the student and the course instructor. We'll look at that first as we look at slide 4. Then we have to look at requirements for approved standardized procedures to be in place before beginning practice. We have to look at the requirement to furnish drugs and devices pursuant to a standardized procedure, and we'll have to define what a standardized procedure is. We'll discuss standardized procedures on slide 16. The next key point we'll talk about will be a furnishing responsibility and what furnishing responsibilities are around controlled substances in Schedules 2, 3, 4, and 5. Those have to have patient-specific protocols in compliance with Health and Safety Code Section 11000 for nurse practitioners. Those will be described in slides 26 and 27. Additional key points include furnishing responsibilities for Schedules 2, 3, 4, and 5, for controlled substances to be furnished with a patient-specific protocol in compliance with Health and Safety Code 11056 for certified nurse midwives. These will be described in slides 28 and 29. Another key point that will be described is the pharmacy rules and regulations for nurse practitioners and certified nurse midwives, and these will be described in compliance with health and safety codes and OBRA 1990, section 483 through 40, and the Federal Register. This will be described in slides 30 through 33. So first, let's look at the first key point. The first key point is the mechanism for ongoing communication between the course instructor and the student. The mechanism that will be primarily used is email, and the email address is npcourses@aol.com. All emails will be answered within 48 hours with the exception of Fridays. Emails received on Friday will be answered by Tuesday morning Pacific time in California. If you have technical and non-academic questions, you can use the phone number 323-656-1606 Monday through Friday from 8 a.m. to 1 p.m. Pacific time. As we go through an outline of this module, we'll have to mesh into it certain enabling objectives that are required by the California Board of Nursing. So specific terminology is required to be addressed by the California Board, and that includes these enabling objectives. Those include pharmacodynamics and pharmacokinetics of the controlled substances. Controlled substances will be described and discussed throughout this course. We also have to discuss definitions of drug laws governing furnishing of controlled substances, use of controlled substances in certain patient groups, and understanding adverse reactions of controlled substances, drug-drug interactions, and other things pertaining to controlled substances. In addition, there will be a glossary of terms important to understanding this module. We'll come to that glossary in a little bit, as well as key points relevant to furnishing controlled substances by the nurse practitioner in the state of California. With respect to other enabling objectives, upon completion of this course, the nurse practitioner will be able to understand the furnishing responsibility of the Controlled Substances Act, the health and safety codes in California, particularly those pertaining to controlled substances in Schedules 2, 3, 4, and 5, and the OBRA Act of 1990. OBRA is the Omnibus Budget Reconciliation Act that was passed first in 1990. This will be covered particularly in Session 8A, which is Introduction to Prescribing of Controlled Substances. The student will also learn to list laws governing the furnishing of controlled substances in Schedules 2, 3, 4, and 5. Also covered in 8A, the Introduction to Prescribing of Controlled Substances. Other enabling objectives that the student will be able to know upon completion of this course will include describing the relationship of the nurse practitioner in collaborative practice, including standardized procedures that govern the furnishing of controlled substances. As we get further into this discussion, along slides 18 to 24, we'll describe standardized procedures in more detail. We'll also detail the components of the controlled substance prescription in Session 8A, Introduction to Prescribing Controlled Substances of the course. Additional enabling objectives will allow the nurse practitioner upon completion of this course to discuss pharmacokinetics of controlled substances in Session 8A, Introduction to Prescribing Controlled Substances. Pharmacokinetics deal with 4 key parameters: absorption, distribution, metabolism, and excretion of drugs. Additionally, the nurse practitioner will be able to describe how controlled substances are impacted across the lifespan by factors such as metabolism and excretion. Again, those 2 key pharmacokinetic parameters will be discussed in the Introduction to Prescribing Controlled Substances. Other enabling objectives that will be covered and which the nurse practitioner will understand upon completing this course will be understanding of indications and uses of long-acting opiates. These will be covered both in the introduction module in 8A and also in Module 8C, which is implications of prescribing controlled substances. In these modules, patient assessment and duration of treatment will be examined. Also in these modules, a description of adverse drug reactions of the opiates will be covered, as will descriptions of adverse drug reactions of stimulants and adverse drug reactions of depressant-controlled substances, such as barbiturates and benzodiazepines will be covered. Additional enabling objectives that will be meshed into the Controlled Substances course that the nurse practitioner will understand upon completion will be a description of indication for use of the opiates, stimulants, and CNS depressants that are controlled substances. Again, once the student completes Sessions 8A, the Introduction to Prescribing Controlled Substances, and 8C, Implications of Prescribing Controlled Substances, the student will have a good understanding of these things. Additionally, describing indications for use of anabolic steroids, GI medications, diet medications, and sleep aids that are also controlled substances will be covered in these sessions. Discussions of drug-drug interactions with controlled substances that may impact prescribing are covered in the introductory sessions for prescribing controlled substances, as are these sessions covered in implications of prescribing controlled substances in Session 8C of the course. So students upon completing these modules, will have a good understanding of a wide variety of controlled substances, not just the opioids, but additional medications, including steroids, GI medications, diet medications, stimulants, GI and additional depressants, and then how these drugs interact, how these drugs may lead to drug-drug interactions, how these drugs may have adverse effects as well. Another enabling objective that the student will be able to understand and grasp upon completing this course is that the student will be able to consider the disease state of the patient and the pathology as determinants in furnishing controlled substances to patient populations. These are considered throughout all of sessions 8A, B, and C. These sessions encompass things like introductions to prescribing controlled substances, prescribing controlled substances safely, and implications of controlled substances prescribing. Additionally, students will be able to identify appropriate methods to write and transmit prescriptions. An additional enabling objective that the student will be able to understand upon completing the course will be to identify resources for drug information and use those resources to maintain clinical competency for furnishing controlled substances. Throughout Session 8, in all aspects, whether prescribing or prescribing safely, the student will understand how to use these resources safely for furnishing controlled substances safely for patients. Additionally, students will be able to describe the essential components of client education regarding medications, including the names of these drugs, frequency and time of doses, correct dosages to take, how to take the medications, what to do if a dose of a medication is missed, side effects to expect, and adverse events to report to the prescriber. Other enabling objectives that the student will be able to understand after completing the course will include discussion of patient abuse and misuse of controlled substances and methods whereby difficult patients may be handled in practice, whether this involves patient contracts or dismissing of patients. These things will be discussed in the Introduction to Prescribing Controlled Substances and in Implications of Prescribing Controlled Substances Safely. Additionally, furnishing drugs pursuant to legal requirements, standardized procedures, ethical standards, and in compliance with health and safety codes will be discussed in these units as well. Let's move on now to look at a glossary key to understanding the controlled substances aspect of this course, and some of the terms that you will come across in the controlled substances portion of the pharmacology course, but that you may also see at other portions of this course. So some of these terms will be used throughout modules in the controlled substances course, certainly, and again throughout this course in pharmacology. Some of these will be very common sense, and some may be, again, very specific to the controlled substances course. So for instance, terms such as drug, agent, furnish, prescribe, deliver, dispense, standardized procedures, pharmacokinetics, pharmacodynamics, metabolism, absorption, excretion, collaborative practice, drug, drug paraphernalia, drug enforcement agency, controlled substance, opiate, narcotic, practitioner, risk evaluation mitigation strategies, prescriptive authority, pain scale, opioid rotation, long-acting opioid, chronic pain, acute pain, ADHD, benzodiazepine, barbiturate, stimulant, drug testing, distribute, OBRA, schedules, health code, adverse reaction, side effect, and toxicity. So certainly from that list, there are some terms that you might think are common to pharmacology and all drugs, and others that will be rather unique to the controlled substances aspect of this pharmacology course. Let's look now at the definition of a standardized procedure. What is a standardized procedure? Well, first, it's a legal collaborative agreement between the nurse practitioner and the organized healthcare system. It involves policies and protocols that address the scope of practice. And with respect to drugs, it really regards the furnishing of drugs and devices. It also takes into account, however, the chain of command. And with respect to controlled substances, that includes how controlled substances are to be furnished. For instance, does it involve collaborative practice, and who's in charge of that collaborative practice, and what the nurse practitioner's role in that practice is. A standardized procedure must be in place prior to beginning practice, and a nurse practitioner must provide evidence that he or she meets experience, training, and/or education requirements to perform the functions of the standardized procedure. So for instance, if that's furnishing controlled substances, you must meet that evidence or provide that evidence prior to furnishing those drugs. So here are some standardized procedure guidelines. Each standardized procedure shall be in writing, dated, and signed. It should specify which standardized procedure functions may be performed. It should state any requirements to be followed. It should specify the experience, training, or education requirements. It should establish the method for initial and continuing evaluation. It should maintain a record of those authorized to perform the guideline. It should specify the scope of supervision needed to perform the guideline. Additionally, the standardized procedure shall set forth circumstances where the patient's physician is to be contacted. It should state limitations of settings. It should specify record-keeping requirements for the patient. It should provide a method of periodic review. So as you can see, these standardized procedure guidelines for nurse practitioners are put in place to allow you to practice collaboratively with physicians so that your patient's safety is utmost. It keeps the patient safe by allowing safeguards to be put in place so that we're practicing, first of all, within boundaries of the law, but also to make sure there are safeguards in place so that there are checks and balances of your practice. Standardized procedures are full guidelines that are standardized because your state has put them in place to give your practice boundaries and guidelines. Within the state of California, there is a website where your full guidelines of standardized procedures may be found. The slide shows you where these guidelines may be found. So they're found at this website, www.rn.ca.gov/PDFs/regulations/MPR-B-20.pdf. Samples of standardized procedures for each nurse practitioner specialty is in existence. On the next slide, I'll show you an example of that. So, standardized procedures may be found here just by example of these standardized procedures. So, for instance, family nurse practitioners, adult gero primary care NPs, pediatric NPs, adult gero acute care NPs, psychiatric mental health NPs, emergency NPs, women's health NPs. Each subset of NPs has their own standardized procedures and has their own limitations and lists and regulations with respect to care. So as you practice, you will have your limitations and standardized procedures that will dictate the regulation for your care. So as you go to that website, you will find your substandards and standards which dictate your standardized procedures. In this course, information pertinent to standardized procedures may be found in at least two places. First, in the implications of controlled substances prescribing, in session 8C. There's a lot of safety information in that module, and safety information is really at the heart of standardized procedures. Again, standardized procedures give you boundaries, basically, with regard to where and how you may safely prescribe. In session 8A, the DEA number and rules regarding obtaining and retaining the DEA number are given. So session 8A, which is an introduction to prescribing, gives a good overall and overview of standardized procedures with regard to controlled substances prescribing, and so that information may be found in that module. So those are two good resources for you there with regard to standardized procedures and controlled substances furnishing in this overall module. Additional information on standardized procedures may be found as you look for controlled substances information, again, in that introductory module. Session 8A discusses types of collaborative practice, discusses eligibility for furnishing controlled substances, discusses rules for drugs in Schedules 2, 3, 4, and 5, the controlled substances, describes patient assessment as an indication for controlled substances across the lifespan. All of those, again, very pertinent to standardized procedures, because again, the main focus of standardized procedures are the rules, the boundaries around which patients may get what, and what the role of the nurse practitioner is in furnishing those drugs to which patients. So the next key point is key point 3, and key point 3 states understanding requirements for furnishing drugs and/or devices pursuant to a standardized procedure. This is the next key point required by the California Board of Nursing, and this was already described relative to standardized procedures in slides 16 through 22. So standardized procedures embrace a lot of what furnishing drugs and/or devices is, and that it requires training in standardized practice, including knowing indications for medications, duration of treatment, and alternatives if necessary. As you go through a lot of this material, you will see in particularly session 8A of the course also, this will be reiterated for you. So understanding requirements for furnishing drugs and devices safely is covered in standardized guidelines and procedure guidelines, and those are reiterated for you in sessions 8A in particular, and in session 8C. So in this course, this content may be found particularly in the Introduction to Controlled Substances session 8A in particular. And this session discusses types of collaborative practice and eligibility for furnishing controlled substances. It discusses special considerations for drugs in Schedules 2, 3, 4, and 5, and it describes patient assessment as an indication for controlled substances across the lifespan, with emphasis also on pediatric and geriatric prescribing. In addition, as I stated earlier, you'll get a little more reinforcement of this key point in session 8C, which further reinforces a discussion of prescribing controlled substances safely. In this session, you will discuss safety concerns with opiates, including patient suitability for opiates. This session also describes risk evaluation mitigation strategies. How do we know which drugs can be used safely in which patients and which drugs have safety warnings or black box warnings or times when we maybe should discontinue drugs in certain patients? So this module looks at safety concerns with long-acting opiates, safe dosage escalation and reduction, opioid rotation. All of those things will be considered in session 8C. It also describes things like auto-injectors, patient-controlled analgesia pumps, transdermal, transmucosal mechanisms of drug delivery, and other patient safety issues. The next key point on the list is key point number 4, and that is the furnishing of controlled substances in compliance with Health and Safety Code 11000. And this is the California Uniform Controlled Substances Act. This act covers any licit and illicit drugs. It includes terminology and schedules. It includes definitions pertinent to prescribing controlled substances. So as we look at this act, throughout this controlled substances course, you will find material relating to this information in all 3 sessions. Session 8A, the Introduction to Controlled Substances, covers some of this information, as does Prescribing Controlled Substances Safely, as does Implications of Controlled Substances Prescribing. Covers information regarding licit and illicit drugs. Terminology and schedules are presented in all 3 sessions, as are definitions pertinent to prescribing. So you will find this particular key point well covered in all 3 sessions, because terminology will certainly be used. Licit drugs are covered in all 3 sessions. Illicit drugs are discussed in all 3 sessions, and definitions are certainly covered in all 3 sessions. Our next key point 5, is understanding the furnishing responsibility of controlled substances in Schedules 2, 3, 4, and 5, using patient-specific protocols in compliance with Health and Safety Code 11056. This health and safety code includes controlled substances, both licit and illicit, and drugs such as barbiturates, anabolic steroids, and stimulants. This information, as you will also find, will be covered in all 3 sessions, 8A, 8B, and 8C. So, with respect to this key point, you will find material relating to this information in the Introduction to Controlled Substances session, which covers rules for furnishing controlled substances. Rules for furnishing controlled substances will cover licit and illicit controlled substances, and it will also cover drugs such as barbiturates, anabolic steroids, and stimulants, and that also covers prescribing controlled substances safely and patient-specific protocols. That is discussed a little bit more in session 8B. Our last key point is key point 6, discussion of pharmacy rules and regulations for nurse practitioners and certified nurse midwives, health and safety codes, OBRA 1990, and the relation of pharmacy and nurse practitioners with respect to safe patient outcomes and controlled substances. This key point is covered in all 3 sessions. Health and safety codes and a definition of controlled substances for the state of California is covered a little more specifically in session 8A. So let's look at a few specifics to this last key point, assuring patient safety with respect to the health and safety codes, OBRA, and communication strategies. So first, the Omnibus Budget Reconciliation Act of 1990. This is probably covered most in sessions 8A and 8B, where risk evaluation mitigation strategies are primarily covered. The Omnibus Budget Reconciliation Act of 1990 really talks about communication strategies for patients, as do REMS, risk evaluation mitigation strategies. So these 2 things really allow for communication strategies with our patients either via pharmacy communication, that's really what OBRA focuses on, for the patient to have a mechanism when they pick up a prescription to be counseled through pharmacy or to be counseled through hospital pharmacy, to have a discussion with a healthcare provider about the medication they've just been prescribed, and to find out about that medication. Are there any adverse drug reactions they need to be aware of, side effects, anything like that? What is the duration of treatment, etc. But also that prescribers need to be aware of any other high risks with respect to medications through drug manufacturers. And that's what risk evaluation mitigation strategies are all about. So those communication strategies are all part of making prescribers safer prescribers, and also making patients safer with respect to taking medications and reducing bad drug outcomes. So now we have better, safer prescriber interactions and better, safer patient outcomes when noting problems with prescriptions, whether those are drug-drug interactions, duplications, adverse drug reactions, incorrect duration of treatments, potential drug misuse or abuse of medications. So whether that comes through patient counseling or prescriber notification, hopefully we'll get better outcomes. So this key point, again, allows us to discuss pharmacy rules for nurse practitioners, certified nurse midwives, health and safety codes, OBRA, and the relation of pharmacy with nurse practitioners and with respect to safe patient outcomes and controlled substances. Primarily, this is covered in session 8A, our introduction to safely prescribing controlled substances. So assuring patient safety, health and safety codes, OBRA, and communication strategies, again, primarily found in session 8A, but the implications of controlled substances prescribing is also reiterated in session 8C, where we really look at certain patient populations and also where we can look at patients who struggle either with addiction or abuse issues and how to address problem patients as well. So those things are followed up in that unit, and that can also be something where we can further counsel patients who may be struggling with additional drug issues. Additional resources specific for California nurse practitioners can be found at the following sites. First, an explanation of standardized procedure requirements for nurse practitioner practice. Second, frequently asked questions regarding nurse practitioner practice. And third, nurse practitioners, laws and regulations. That summarizes this module. Practice safely. Thank you.